Hello everyone. Welcome to the channel. Here comes the second video in Nuclear Medicine MCQ series. It takes lots of time and efforts to make these videos. If you are finding the videos useful, kindly like, share and subscribe the channel for more such videos. The topic of today's video is prenatal radiation exposure, and this video is recorded by Gurkirat Singh Nizer.
Let's practice multiple choice questions on prenatal radiation exposure. The rules for the question and answers will be same as the previous videos. Each question will be provided with 25 seconds of timer, and then after 25 seconds the answers will automatically pop up on the screen. All the best everyone. Let's begin with question 1. So in terms of teratogenic effects, organogenesis period, which is roughly 2 to 8 weeks, is the most sensitive to radiation exposure. Next question. Yes, generally it is said that at very high radiation exposure during pre-implantation period, the most likely effect is of fetal death. It is 50-50% chances whether the child or fetal will survive or not. Next question. In terms of intellectual disability to the fetus, the pregnancy stage in which the exposure to radiation is at highest risk is early fetal period, that is developmental period of 8 to 15 weeks. Next question. Yes, the dose decided by IAEA and ICRP for an increased risk of fetal malfunctions is 0.1 gray, that is 100 milligray. During fetal period, like developmental period, the least likely occur outcome for prenatal radiation exposure is teratogenic effects. Next question. As per ICRP, the maximum allowed radiation dose to fetus is 1 millisievert. Next question. The increased risk in childhood cancer to the offspring is generally due to the gamma rays radiation exposure during pregnancy. Next question. Among all the four options, the option C is the most true about radiation exposure in prenatals. That is, the risk of mental retardation increases with radiation exposure during 8 to 15 weeks of gestation. Next question. Among all four, genetic mutations in future generation is not a potential long-term effect in the prenatal radiation exposure. Next question. Among all the four options, the highest risk for the development of fetus is due to multiple computed tomography or CT scans. Next question. Since we discussed in the previous questions, the most sensitive phase of prenatal development in terms of radiation exposure is embryonic stage. Next question. The primary health risk of prenatal radiation exposure in first trimester is none other than which is organ malfunctions. Next question. Among all four given options, the most harmful radiation for the development of embryo is gamma rays. Next question. The severe mental retardation can likely to occur at more than or equal to 100 milligray of doses when fetus is exposed between 8 to 15 weeks of gestation. Next question. The most sensitive biological system of a fetus during development of the fetus is the nervous system. Least sensitive radiation induced malfunctions can be seen in pre-implantation. Next question. During second trimester, during the developmental stage, the growth retardation is the primary concern due to radiation exposure of the fetus. Next question. Below 50 milligray of radiation exposure, there is no significant effect on the development of the fetus. Since the minimum limit is decided by ICRP is 100 milligray or 0.1 grays. Next question. The risk after 25 weeks of gestation, that is late fetal stages, is of cognitive impairments only due to radiation exposures. Next question. The most appropriate option among all four options is B, that is consultation with the radiologist or obstetrician if a pregnant woman undergoes an unplanned radiological procedure. Next question. There are more likely chances of higher sensitivity in males than females in terms of radiation exposure to the fetus. Next.
Thanks for watching. Kindly like, share and subscribe the channel for more videos. Happy learning.